Well, I'm Jeff Smith, and this is my friend Abdul, Dr. Abdul, and we're here in Makeni, Sierra Leone, Africa. And Abdul has been a surgeon and a doctor here since 2020. Is that right, Abdul? 2018, and his father started this. So, Abdul, do you want to just tell us a little bit about the facility?
Oh, okay. As you've introduced, I am Dr. Abdul Sise, a medical doctor, yet to do my specialty. And this is City Garden Clinic. And City Garden has been the hub for Makeni, and it has been rendering services to people who cannot afford and those who can afford, the middle manpower. And I'll be showing you around the hospital, so you get to see different units and what are the developments that we've had from the donors, partners who have been supporting us, so that City Garden will be the way it is at the moment. Here at City Garden, we do varieties of almost everything that pertains to medicine. We do see cases of internal medicine, we do see cases of surgery, pediatrics, and that of obs and gyn. So as a facility, we are not limited with so many things because we do see cases of all aspects in medicine. But however, there are challenges because there are sometimes we are faced with limitations because we don't have the reagents or the necessary materials to execute those duties that we are meant to do for our patients. So we deal with what we have in our facility and try as much as we can to help people with what we have.
Thank you, Abdul. And they do things extremely well. Everything very well here. Amazing people. Rock and rolling in here.
Moved out to see the patients. Once the clinician has seen the patients, there are 6 private rooms from this side, going that side. So if we have VIP cases and people who can afford that wants to be in a private room, they occupy these rooms, and there are 6 rooms. Okay. So if normally when we do our elective cesarean session, because we don't run maternity here, but we have companies, these insurance companies that we do treat, and if they want to do their deliveries here, elective cases, they are admitted in the rooms here. You can come see.
Hi guys, how you guys doing? Good. Good. You look good.
We extracted the tooth and we did incision and lineage to
drain all the
drain. And this boy had a history of fall, so he was unable. Had a history of fall. So these are the beds.
Wow.
So we don't have another place to keep them, so we had to keep them.
So those are new beds.
Solar system. Oh, so this is where the batteries are and everything.
So those are the cells down there that hold all the energy.
So the main control is here. They do the control.
That's awesome. That is a great update.
Yeah. When ABD is not around, myself or him, we do most of the surgeries. If I'm not around, ABD is not around, we will do the surgeries and everything.
Excellent.
Yeah. If we have terrible bad cases, we wait on him. Right. When he's there, we learn from him the way he approached them. Right. These are the wards. You know, most of the other patients who can walk, they go out during the day so that they get fresh air. When they are tired of sitting, then they come in. So they have come in. He had a femoral head fracture.
Okay.
On her, that one has chronic leg ulcer.
Okay.
So that needs an SSG at the end of the day. So this is the place where we sort them out. Those that need admission will be admitted, and those who don't need admission will not be admitted.
Here after about 10 in the morning, this is packed with people, right? It's just packed with everybody, you know, because this is the whole outpatient center.
You got me.
How are you working?
Well, I'm done now. I've just finished seeing the few patients.
Oh, were you really seeing patients today too?
Sure. And people are sick. They are sick all the time. The guy who is our supplier has messed us up.
The reagents.
The machine was working very well, and then no more reagents. He needs this hematology reagent. You know, then this will do all the necessary parameters. You put your blood here, HB, WBC,
right,
everything.
Exactly.
You just the click of a button, you have all the reports. And now we have problems with him to get us the reagents.
So is that like a supply chain thing throughout
It's a
the
supply
world,
chain
or
problem.
is it-
This is a company called BioBase, and it is not a universal machine because other hematology analyzers, you can use different types of reagents.
Right.
It accepts them. This doesn't.
Oh, boy.
Only from BioBase. The biochemistry machine is universal.
It is, okay. Good.
Yeah. So he messed up with supplies. We got another supplier. So now we can do our biochemistry work.
Good.
And later on, I added up a new machine to do PSA test and to do some hormone test. Because we usually send all our patients to Freetown to do PSA tests for prostate cancers and other things. So we do all our basic things here now. So this is for PSA. It's a very simple machine. You have this chip.
Reagent thing in there.
The chip is here, and you have this. Then you have this stuff here. And then you take this, then you fill your blood sample, you fix it, then it runs your test very easily. This costs $5 for one.
Yeah.
So it saves a lot of money for the patient. And the cost of transportation, even to go to Freetown, you know, it saves a lot of money.
This is the new septic tank which was recently constructed.
What is this?
Septic tank,
Oh,
all the
septic.
waste.
Okay.
Yeah. So this one had problem. So we had to refix this
Had
one.
to dig a new one.
Yes, we dug a new one and we it was maintained.
Generator, right?
Yes, there you go. So this was a donation by Dr. Smith and their family. So they donated this when we were in a situation where there was no light system in the township of Makeni, and this was the only one that was working by then, and it's breakdown. So at that time there were financial constraints to the hospital, and the parts which were needed to fix this were so expensive. And thank God Dr. Smith was able to fit in. So this was a donation from them, and it's working nicely. So with the help of God, we've been able to fix this one also up. So now we do have backup.
Oh, that is great.
Yeah. So this one is running, unless if we don't have light, if you are doing a procedure and we need lights, we can just use this one. And there are 2 beds in each, and they've got self-contained. The toilet is inside.
Oh, very nice.
Yeah. So normally we do restrict relatives from coming within the next 2 weeks if we suspect a TB case and we want to start them on their TB medication. But it's really, really difficult because even if you try to talk to the relatives about the condition of their patients to separate themselves for the next 2 weeks, it's challenging. So you get to see them there almost all the time. So there was a project which Eddie undertook before she passed on.
Okay.
And when she passed on, there is this funding that came in with World Hope. So World Hope, we are the ones that were the pioneers. So every Thursday, we used to do free cervical cancer screening.
Okay.
But before they took over, we were doing it in the facility here on every Tuesdays and Thursdays, twice a week. But at some point, it went down to only once in a week. That's on every Thursday. So when World Hope took over the project and everything, so we dedicated this place on every Thursdays for free cervical cancer screening.
Okay.
Yeah, so we do the screening here. Dr. Amber, when she was here with the students, every Thursday they assist people here to do this free cervical cancer screening. And we have staff who we are dedicated for that side. They went for training and everything, so they are also allocated here on every Thursdays to do the cervical cancer.
Ladies are just not checked for it and tested for it, so that's why this is such an important project, because cervical cancer is definitely survivable as long as you catch it early. Right? The United States has a very sophisticated. I mean, every woman gets checked yearly for cervical cancer, so we generally catch it when it's either super early or maybe not even cancer yet. Yeah, so.
Early.
But here, I mean, most women don't get screened for anything.